Today I'm speaking with Nina Lansbury Hall from the University of Queensland, who has recently published an article in Rural and Remote Health titled Five Enablers to Deliver Safe Water and Effective Sewage Treatment to Remote Indigenous Communities in Australia. Welcome, Nina.
Thanks, Melissa. Good to be here.
Great to talk with you. I wonder if you could first tell us who was in your research team.
Pretty amazing team. So Professor Sandra Creamer, who is a Kalkadoon Wanyee woman and the CEO of the National Aboriginal and Torres Strait Islander Women's Alliance. And we've been working together for about 4 years now on issues in remote communities mostly Indigenous communities. Then we have Professor Wendy Hoy, University of Queensland. She's really well known as a nephrologist, a kidney doctor. Also a long history working in a remote Indigenous settings around clinical health and the context in which people are receiving care. And I know our paper's about water, but water and kidney dialysis, it is actually quite interlinked. And when you are finally on dialysis, you need really good quality water. And then we have Professor Amanda Lee, who is also at the University of Queensland. She's a really prominent nutritionist who's a lot of her work is based in the APY lands in South Australia and the border of Northern Territory, looking at nutrition policy, but a real focus on sugar sweetened beverages, SSBs or soft drinks, and the issues around what drive people to or from consuming large amounts of soft drinks and all the flow on nutritional effects on your health from them. So we all come from a different dimension around water and sanitation, but we all have spent time working in and learning from working in Indigenous communities, and Wendy, Mandy and I, who are non-Indigenous Australians, learning from and working closely with Indigenous colleagues.
Brilliant. So how did your study come about?
I have an environmental science and a social science background, and I've come more recently to public health and to Indigenous issues, and I spent a number of years looking at water, drinking water, water security, water issues, water contamination, and the Sustainable Development Goals of the United Nations, of which Australia is one of 197 signatories. They were signed in 2015 to be achieved by 2030. They're quite detailed, and I love talking about the SDGs because they're really high ambition. And one of the 17 goals is around water and sanitation. And by signing up to these goals, Australia is publicly committing to achieving them, or at least making a really great effort. And from my engagement with government in consultation processes and in the water industry engagement, there is a real desire to raise the standard and meet those goals. I was looking at the Sustainable Development Goals, number 6. I've got a report out on the status of water and sanitation in a range of communities, and that led to an evaluation of a great initiative in the Torres Strait Islands, which is the vision I have behind me. This is from Kariri or Hammond Island, where Queensland Health, as the regulator of the Public Health Act, went to the Torres Strait to work in collaboration with community, with the local Indigenous Council, and really started with this question: how can we do it differently? The way we're doing it isn't working. We've got to rethink it. We've got to be led by people on the ground who actually know what the issues are. And so there's some really great initiatives out, and I cite that case study, and I also cite a case study from New South Wales, which is also a really effective long-term new way of thinking about water and sanitation delivery.
Terrific. So what actually needs to happen next?
Yes, so the reason that Wendy, Mandy, Sandra and I put this paper together is we really felt we were talking to a range of audiences that were very, very interested. We were talking to the water industry through their annual conferences and through keynote invitations. We were talking to state and federal government at their invitation, and we were talking to non-government audiences, as well as talking to remote community residents and organisations. And we found that we were telling this very simple story each time, but it was really it really seemed like it was the first collation of these ideas that had been brought together. So we called them 5 enablers because they are just conditions that need to be considered. If you're going to be delivering safe water and effective sanitation, there's really just 5 things that need to be thought through. But they're a little bit radical because some of them are not business as usual. So firstly, people. We can have all the technology in the world, but if those people on the ground are not trained on that technology, are not supported by those who know how that technology works, and also the cultural engagement and awareness, if they are Indigenous people liaising with water utilities with non-Indigenous people, do they feel respected? Do people know that they're maybe engaging in a bi or multicultural situation? So firstly, people factor. Secondly, cross-agency collaboration. In Queensland, we've got Queensland Health as our health department, but local government, the Department of Local Government, Department of Water, I mean, they always change names, but these are essential names. They need to talk to each other. They're trying to deliver a health outcome for the population, but one is looking after the resource, and one is looking after the health outcomes of the people, and one is looking after governance aspects. They actually are going to do a much better job when they work together. And the 2 case studies that we provide show how well that's been done. And of course, local government and local agencies are really important in that collaboration. Third one is technology. So technology is important, and there's a whole range of issues around how water becomes contaminated. It can be biological, it can be chemical, chemically polluted, it can be industrial and agricultural pollution. And the right technology has to be matched with that. And some of it's very expensive and very technical. Some of it's very simple, but every situation has a different water source, has a different set of contaminants, has a different energy source, has a different staffing source. So while it does sound like a great big headache, in the Torres Strait, they have 15 different water operations because they have 15 different inhabited islands, and they have different water sources, different challenges. That's what you got to do. It might be a small population, so it's not going to be efficient financially. Goal is health. We're talking about rural and remote health in your journal. That's what we got to get to. So the technologies that are fit for the place, as in the water source and fit for the purpose. What's your goal you're aiming for, and fit for the local people. What are they actually going to accept? If water is scientifically safe to drink, it smells funny, it looks funny, it makes your tongue funny, you don't necessarily want to drink it. So it's potable, but it's not palatable. And that's actually a big conversation to have around local acceptance. And then just look 2 more, funding. These are not issues that you solve once and you walk away. It's long-term sustainable funding. These are essential services. Funding needs to be sustainable and adequate. And then finally, a systems view, because water and sanitation systems, they don't exist by themselves. There's all these other interactions. There's contaminants, might be birds, might be stock coming down into a surface water to a pool or a dam. There might be underground contaminants. You've got to look at how people are moving in and out of the system. And when you install water, where does the governance end for the local authority? Where does the housing authority take over, and where does the householder take responsibility? That's all the system as well, which is a little bit complex, but the value of thinking in a system means that we're not naive about, this pipe has clean water and we can certify it to this tap, but once it enters the property through and sits in a tank for the next 3 weeks before it's drunk by the resident, who's responsible for that and how did that become contaminated? So signing off at the property line is great, but that's not the end of the system. So having a systems view is going to be a much more sustainable approach in the long term.
It's really, really important work. I was just sitting here thinking how much I take water for granted.
We're
Wow.
allowed to. We live in the city.
Yeah. Yep.
We know that, that tap in the backyard, we can drink it. We can wash our children in it. Australia is incredibly lucky. We have very high standards. The Australian Drinking Water Guidelines set very high standards. But also, as we all know, if we were born in another country or we travel somewhere, no country has tap water that's safe to drink, or you might buy it into your house, but the outside taps are not safe. So yeah, it's another moment where we think about privilege and where we live and the systems that support us.
Absolutely. Well, it's really fascinating and important, and I can't wait to hear what you get up to next, Nina. Thanks very much for talking with me today.
Thanks for publishing our article, Melissa.